Hi, I'm Tony Williams, and this is Brooklyn Savvy. Hi, I'm Tony Williams, and welcome to Brooklyn Savvy. We're going to be talking about sickle cell anemia and thalassemia on this episode of Brooklyn Savvy, but before we get started, let me introduce our panelists. We have Dr. Viswanathan. And we have Dr. Ayanna Batiste, and we have my friend and colleague, Donette Carroll, and you are the founder of the Sickle Cell and Thalassemia Patient Network.
Well, one of the founders.
One of the founders, one of the founders. And this is something that we've been trying to do for some time now, to bring out sickle cell anemia, because when I was growing up back in the 70s, there was a lot of discussion. If it wasn't for you, I don't think I would have even thought or talked about sickle cell, but we used to talk about it almost on a daily basis.
Yes.
Because you were so passionate, because you have sickle cell anemia, and you were passionate about it, and you were an advocate for it, and you were a spokesperson. So I really admired your taking your condition and then elevating it so that you could help to create an organization that would help a lot of other people. So congratulations to you for that.
Thank you.
But for our audience, I'd like to just talk about what is sickle cell anemia.
Sickle cell disease is really a disease of the red blood cells.
Okay.
So if you look at the body has blood, and that runs through our arteries and veins and capillaries. And there are three kinds of cells: the red cells, the white cells, and the platelets. So the red cells have a protein called hemoglobin, and the hemoglobin helps to carry the oxygen. So normal adults have hemoglobin A, and this is what you inherit from your parents. But patients with sickle cell disease have hemoglobin S, or sickle hemoglobin. So when they have sickle hemoglobin, the cells, instead of being nice donut shaped, they end up becoming sickle shaped. And some people call it a C, but for years it's been called sickle shape. And what it does is the cells are very rigid, and so they cause a lot of problems, and we can talk about that.
Right, well, and I think the main problem is the crisis and the pain, am I correct?
Right.
Right, and Donette, you have suffered with that.
They thought I had arthritis. And I could understand why now, because the joints swole, the joints were hot, and the joints were paining. And that's pretty much what you have when you're in a crisis with sickle cell. The joints swell, the joints pain, and you have heat coming out of it. But as far as they thought I had arthritis. It wasn't until I was 25 I was really properly diagnosed with sickle cell.
Now, Dr. Batista, when it comes to us, how is it treated? How do we treat this particular disease?
Well, sickle cell disease, as we've been talking, is characterized by severe pain. So in acute episodes, really the management is management of that pain, which can be, as you said, severe. It can affect any part of the body, really. And when it's affecting especially the lungs, it can result in people having difficulty breathing. They may need to come to the hospital, get IV hydration, get antibiotics. But usually the mainstay is pain control. So this is the mainstay.
So you can live through the crisis, essentially, is what you're saying?
Well, yes, that's the aim, to make sure that the patient lives through the crisis, because it can be quite severe. But other complications occur. It's not only just pain, it can affect your kidneys, your liver. It can cause any part of your body to go awry. And right now, unfortunately, there are not too many treatments. There are actually only 2 drugs that are approved for sickle cell disease. One is a drug called hydroxyurea, which has been for around 20 years now, and it's quite effective when it's taken. We have a problem sometimes with people not taking the medication, but that is one of the mainstays. Also, a new drug more recently called Endari, or L-glutamine, which is new, and so we are now really beginning to experience that drug. But ultimately, we are looking for cures.
Are research dollars, though, going to sickle cell anemia?
Well,
Or sickle cell disease, however we may.
Yeah, so I've been involved with sickle cell disease in this country for about 35 years. And
You look too young for that.
and so I can tell you that I've been, to the NIH for meetings and, in the 90s and late 80s. And the thing is, right now, definitely there are some more research dollars than there ever were.
What does
But-
that number look like, though? I don't know why.
So
Right.
more than research, there is research going on, and it is going on at a national level. And we are actually on the cusp of really, we had this medication that Dr. Bhattis talked about, hydroxyurea, 20 years ago. And then 20 years later, we get this medication approved last year. But at the current moment, there are at least 4 or 5 in the pipeline that are really doing well. So I would say research-wise, that's happening. But the one thing that sickle cell patients need is a comprehensive program.
Okay.
So I'm a pediatrician, I'm a pediatric hematologist. So I run a comprehensive program. And what is a comprehensive program? These babies, and I'm sure one of your questions is, how do you diagnose a child
Right.
with sickle cell disease? A baby is born, and in New York State since 1975, there's a test called newborn screening.
Okay.
All babies, they get 4 drops of blood in this little filter paper, and we started testing for sickle cell disease back in 1975. So within a couple of weeks, we would get a phone call from the state saying, this baby that was born in your hospital has sickle cell disease. And so we would call back the family, seat them down and tell them, your baby has sickle cell disease. And we would tell them how they got it, because you can only have sickle cell disease if
It's
each of them-
genetic. It is genetic, right.
It's
We need to-
genetic,
right.
and what we say, it's autosomal recessive, which means each of the parents has to have at least a trait.
Oh, I see. So 2 traits makes it.
2 traits.
Yes,
If
right.
they take the trait from each parent, then they have the
Right.
disease. So if both parents are traits, you have a 1 in 4 chance of having a baby with sickle cell disease with each pregnancy. Because people sometimes say, okay, I had my first baby, that
So
was
that's the
sickle
one.
cell,
Those
and the
are
rest
the
3
three.
are okay, and
Right,
that
can't
doesn't
think like
work
that. No,
way.
no,
But
right.
more than anything, we are at the stage where we want to tell parents, we want people to know their sickle status. We want them to know, do they have the trait? And Donette will tell you this very well, because there is SS, where both parents have the sickle trait. There's SC, where one parent has a sickle trait and the other one has a C trait. So sometimes I would have a father come and say, what do you mean my child has sickle cell? I know I don't have the sickle
Right.
trait, but we get them tested and they have the C trait or the
I see.
thalassemia trait. And the sickle combined with each of those can make, it's a form of disease called
I
sickle
see.
SS or SC.
Right,
for S.
right.
So and I think that's very important for people to know that, that it's not just sickle trait, but it's also C and thalassemia.
So when a young child has sickle cell, what is the treatment plan, and how are parents engaged in that? Because it sounds to me as if you have a child with sickle cell, there's some issues here now. It have to do with their classroom studies, physical education. I mean, that's what I would think. So if you
Yeah.
could talk a little bit to our viewers about what that entails.
Absolutely. So that's the most important thing. The most important thing is education. So you need to educate the parents. Firstly, you have to support them, because it's a shock sometimes for families. Nobody,
It's not like you ask somebody, do you have trait? but then maybe you
It's a
should
wise
ask.
question, yeah.
But anyway,
but you're right, absolutely. I think, it's something that people should know.
and should
And then they decide.
but they should talk about. Meaning,
should
this
talk
is something
about
worth talking about for
Right.
sure.
Because
So,
7 to 8% of African Americans carry the trait.
and it's not just African Americans.
And it's
though.
not
That
just
carry-
African Americans.
Yeah, aren't there
Right.
Mediterranean, like people from the
Absolutely,
Mediterranean?
there are people
So it's
from the
not,
Mediterranean.
In India.
In fact, if you look
it's
at
not just an a black person's disease. so
Oh,
to speak.
no.
My
And
wife-
the amazing thing is, over the last 5 or 6 years, people realize that if you look at population-wise, the maximum number of patients with sickle cell disease is in India.
Interesting.
And
Interesting.
thousands of babies get born in Africa with sickle cell disease every year. And before the 70s, 30% of these children would die because of infection. So that's why we give them penicillin from the time we diagnose them till
Right.
they are 5 years of age. we give penicillin to prevent infections.
Okay.
Not that it completely prevents, but
Right.
and then we teach the families, if your baby has a fever, call us right away, come to the
Right.
emergency room.
Now, do babies go into a crisis?
Yes.
Oh, that must be
And they
just the
get
worst thing to
swollen
watch.
hands and
That cannot
feet.
be. Right.
Because as a
Distressing.
child,
Oh,
I
it's
had
so
it,
hard.
you know, and the irony is because, and this is just a little tale I'll tell, when I was growing up, because there was no knowledge about sickle cell, you'd be so good one day, and the next day, oh, my hands were swollen, my feet were paining, but my folks, they thought that someone put a spell on me.
Oh my word!
But
my
that,
word, but
because that you
the
can
way
see
people
the
thought then.
Thought then.
Just the way it was.
Because it was so,
Interesting.
sudden.
And erratic. It's like
right.
one day
It's
here,
like one day
sporadic.
you're
Yeah,
good, and the
right.
next day you're like this. Someone
Interesting.
had to put a spell on you, and they would try everything to take the spell off, not
my
knowing
word.
that this was something that was genetic. You see.
Interesting.
But this was back
Didn't
in
you
the
say they used to give you a tea?
Yes.
But
my
did the tea
great
work?
grandfather
But didn't
used
the
to
tea- didn't the
make this
tea-
tea. We didn't ask what it was because you never asked
Was it?
questions.
Did it have a little cactus in it? I mean, I'm just saying. I mean, if it made you feel better.
But you know, the thing is that whatever he did, it made me sleep. And once I woke up, the pain would have subsided. And they had their own home remedies because we had no painkillers, so to speak.
Right.
You know, so it was a matter of really using the brain. He would actually use, I call it now visualization. He would try to get your mind in a different space and not think on the pain.
Oh,
and that's why
Loving.
I
Very
think I
loving.
deal with pain, right, I deal with pain the way I do now. I visualize myself in some different space. He would always talk about the walking through the lilies of the fields.
Wow.
You know, and you know, imagining yourself where there are birds chirp. It's a
It's funny
distraction.
how that came from his spirit to speak to you that way, and now people call it New Age. But he was doing that because it's the natural place where a pure spirit would go, right?
But he just wanted to ease the pain too, and, you know, and he helped me not to focus on the pain, but to focus on something else.
Right.
You know, I
Wonderful.
think they have a name for that. No, it's not visualization.
I thought it was
but
called visualization.
Imagery, like
I think
Yeah,
imagery?
yes,
Right.
but I don't remember the name of it. But
So you're dealing with young children, and you told us somewhat about the comprehensive treatment plan that you would give and the education that you would give family members.
Right. We would teach them about the different complications.
Okay.
And tell them to be prepared because sickle cell disease can affect from the top of your head till your feet.